I've been with age management since February of 2017, so a year and a half. I'm a physician assistant. I came on board after having worked in neurosurgery and pain management, and prior to that I was a physical therapist and still actually am for about 20 years. Came on board because I really realized my passion is in preventive medicine and functional medicine, and the flip side of what I had been doing, especially in the seriousness of neurosurgery and pain management. Well, Dr. Lee really has been my mentor, and we attended a couple long, 3-day conferences together, and really just have the same philosophy, and I felt honored to be able to learn from him and work with him, and Age Management MD was kind of my dream job. So we look at the person holistically, we take into consideration all aspects of their metabolic self, but then using the metabolic information we get off of labs, we extricate their lifestyle, their diet, their exercise, their stress levels, their personal social situations that might be playing a role, past injuries. I have that background in physical therapy, neurosurgery, and pain management, so I often will talk to people about what maybe either is holding them back physically or what their belief system is about what was holding them back, and try to work in every angle that I can to try to help people feel and function better. Sometimes they're stuck in places that they don't need to be stuck in. Well, the patients that walk through the door and find themselves in front of me and any other provider here are already a special person that's interested in being proactive for their health. So the success rate is high. I mean, it's I don't know, 90% of my patients gain, maybe 100. There's something about the experience that has improved their life and the way they feel and function, without a doubt. I just have to find what it is with them, because I love the depth that we establish with our patients, because again, everybody's a puzzle, and I love success. I love when my patient walks in the door 3 months after I've done something or suggested something, tweaked their hormones or suggested a supplement or taught them one way to do some stress management that was easier than they ever realized was possible. I love when they walk in the door and say, I'm doing much better. I feel great. Wow, thank you. I guess I just like people to thank me. I would love them to know that we take into consideration everything they have already done, and we just try to look a little bit deeper and again bring in the other pieces of themselves that aren't just on a piece of paper or on a lab, for example. Like, what is it going on in their lives that might be contributing to the status? Why don't they feel well? Why is their energy a little bit off? Why aren't they sleeping well? Why is their brain a little foggy? It isn't just one thing, and if you don't find it in a lab, that it doesn't exist. I think that often we will find things that other providers won't find by virtue of spending time with our patients and getting to know them, and really taking just one step at a time. My favorite part about what I do actually is that I can often prioritize this one small thing that ends up having widespread positive outcome in a person's life, and it never ceases to amaze me how sometimes simple it is to have a huge effect in somebody's life.